Good morning and hello everyone. Today I am going to tell you all about the articles and instrument required for an operative procedure PCNL, which is also known as Percutaneous Nephrolithotomy. So at first we all should know about PCNL. What is PCNL actually? So percutaneous nephrolithotomy is an operative procedure which is carried out to remove certain stones from the kidney via a small incision in the back. Basically, it's an invasive procedure to remove certain stones from the kidney, ureter or bladder, which may be carried out under general or spinal anesthesia. So to work as an intraoperative nurse or as a surgeon, one should remember the following articles used in the procedure. First is Pcno Set, which consists of various instruments which we will be discussing in a few minutes, and then surgical drapes, which are Macintosh, medium towel, side towel, cut sheet, leggings to cover all or nearly all of the surrounding area to avoid contamination of the surgical instruments, surgeon's hands, and the sterile instrument fields, or we can just say to maintain this sterility. Another is IV set for intravenous infusion, and then we will be needing lignocaine jelly also. Then ureteral catheter, which is a small flexible internal tube that is placed over a guide wire for negotiation in a ureter, which may be of 70 cm in length and comes in different size as maybe of 3, 4, 5, 6, 7 and 8 French, and along with it its adapter or connector. And then another is a guide wire, which is a device used to guide the ureteral catheter into place, and another is a puncture needle for creating a keyhole or initial puncture through a small incision in the skin. Then another is a urinary catheter to drain the urine, and also urobag, and cystoscope, which is an instrument to look inside the bladder using a thin camera. So another instrument we will be needing is a Anaphyscope, which allows to inspect the renal cavity system and to perform different therapeutic procedures. And then metallic dilators, alkane dilators for dilating the tract, and along with it its central rod, and a series of coaxial sequential facial dilators that enlarge sequentially and pass over an 8 French central rod for dilating the tract. And sometimes we can also need single step dilator, which has got a long tapered tip used in smooth surface for automatic entry during dilation. Another is lithotripter probe, which is a long thin rod that breaks the large kidney stones into smaller stones by sending focused ultrasonic energy or shock waves directly to the stone. And then a traumatic grasper, which we also call forceps for grasping the stone. Then we'll be needing a disease stent because the ureter may become blocked due to the kidney stone. So for that, ureteral stenting might be needed. So a disease stent, also known as double J stent, a thin flexible plastic tube is placed temporarily into the ureter to help urine drain from the kidney into the bladder in case of blockage. Then we will be needing dye or urographene, which is an injectable contrast medium which contains iodine that visualizes the area of the body part that the doctor wants to investigate. And then we will be needing syringes of 20, 10, 5 and 3 ml. So these are the things that is required for performing the surgery. Now let's talk about the Pcno set. The articles that should be included in the PCNL set are a tray containing 2 mosquito artery used to clamp bleeding vessels and to grasp delicate tissues. Well, these articles are rarely used in PCNL but should be included when you are opening the PCNL set for the surgery. And then 2 mid-curve artery, 4 plain artery, 2 coccus forceps, 1 Mayo scissor, 1 suture cutting scissor, 1 needle holder, 2 sponge holder, 2 kidney tray, 2 gallipot, 1 tooth forceps, 1 non-tooth forceps, and 1 scalpel.